Good evening and welcome to Hello, It's Us, a program dedicated to the concept that life in general goes better if we're all working together as opposed to you, me, and them all working across purposes. Hello, It's Us is brought to you by a collaboration between the Center for Disabilities and Development, the Extended Dream Foundation, and all the folks here at Public Access Television Channel 18. We're back with part of our legislators to continue the interesting discussion we've been having. Again, Senator Joe Bolkcom, Representative Bobby Kaufmann, and Representative Sally Stutsman are with us today. Thanks again for being here.
Thank you.
Where do we jump back in?
Well, maybe we should talk. Do you want to talk about mental health redesign and what's going to happen on that or not going to happen on that? We've got a lot of work to do.
That would be a good one.
So, I guess remind your viewers, over the last couple of years, the state of Iowa has been making some changes to our county mental health system, going from a county-based system in terms of its administration and service delivery to a regionally administered system with local service provision. And we are in the process of making a pretty significant transition starting July 1st, where we'll essentially move to this regional system away from a county-based administrated system. And we have some issues this session, mostly dealing with funding and how we're going to fund the system going forward. We have some property taxes that currently support the system and about $30 million worth of state appropriations that we gave this year to counties. And we have some challenges looking ahead as we look at the current budget. It's something that we're looking at the governor's budget to start with, because he's out of the blocks first with a budget. He's appropriated no new money for the 2015 budget to pay for mental health services. So we'll start out early with talking with his people about the need to come up with funding to make sure that as we go forward there's enough resources in the system. There are a couple areas that we need to focus on. One is making sure we have a crisis management and emergency service system. When somebody's in crisis, they need to get services now. We don't have a very good system in most parts of the state for those folks. They end up at the emergency room, and the emergency room is not necessarily able to take care of somebody that's depressed or suicidal. We need beds for people in some cases, residential settings. So that's one area, and the other is in the area of brain injury. We hardly have any services for people in the state that have suffered a traumatic brain injury through a car accident, or a returning veteran from Iraq, for example, where we know we have a lot of vets coming back with concern about that. So there's some work to do to make sure that services are provided in those two areas, but we'll continue to work on it this session, with mostly focused on how are we going to fund this regional system going forward.
Well, there was no provisions in there for developmentally disabled, and I don't quite understand how we can have a system and leave out a whole group of people. So I think we need to really look at that and make some adjustments with that too. And then to deal with this waiting list for the Medicaid waiver. I mean, it's just amazing how many people are on that waiting list, and I don't know how we get a handle on reducing that waiting list. But I think it's something that we need to do.
It'll definitely be a priority of mine as well. I think the redesign had some unintended consequences for some of the folks in my district, and I was also extremely disappointed with the vetoing of the dollars last year, and definitely look forward to working to get those restored.
Yeah. I have a particular interest in the developmental disability one, which is, and there's a whole lot of people out there that are pretty much scared to death what's going to happen, because July 1st is roaring right at us, and I've not heard anything that there's been any movement made on what's going to happen with that, or the waiting list. And it's kind of like the state is begging for a lawsuit.
Well,
Unfortunately, we have thousands of people on the waiting list that in October went back to February of 2011. I don't see where the state has a thoughtful plan to reduce that waiting list. And, you know, it's been mentioned every year since the Olmsted decision.
Right.
And here we are, yeah,
Well,
A thoughtful plan, I think, is
13
very-
years post-decision, and we've still got thousands of people on that list. And, you know, the natives are getting restless. And I'm not sure that lawsuits are necessarily the best way to solve the issue, because the people filing the lawsuit don't get to say what services are going to be new. The state doesn't get to say what services are going to be new. The feds come in and say, this is what you will do from now on. And that may or may not be a good thing, but
well, I think the redesign anticipated the Affordable Care Act and the fact that some people would get mental health services, for example, from the Affordable Care Act, which is going to which started January 1st. So that's a positive piece of this. But this system's been underfunded for a very long time. That's why we have waiting lists. That's why we don't have good crisis services for people. That's why people with brain injuries don't get any services for the most part, depending on where. There's a few counties that have done some things. But at the end of the day, maybe the court cases, maybe it's getting closer than you think to moving ahead with that. Having worked on this issue for a very long time, I don't see much change in attitude from the governor's office. The governor put a provision in the health care bill that 80% of any kind of savings that the county system would receive as a result of the Affordable Care Act, providing insurance to some people that are currently in the county system, that 80% of that savings would have to be given back to the state. And that is, when you have waiting lists and you have people that need services not getting them, you've underfunded the system, and the moment there's some new money from the federal government covering people under Medicaid, people are saying, let's get that money and tear it out of the system and do something else with it.
Because it goes back to the general fund, doesn't it?
Yes, it would.
Yeah.
Yeah.
Yeah, it doesn't go back into
the legislation that was passed, it would start by any savings, it would start, the first thing, counties would have to reduce their property taxes that are going to pay for these things. And if they didn't have any property taxes, the state payments to them would go back. So it's a challenge, and you know, I agree we ought to be able to just work through this, and we're Iowans, come to some agreement. We might not agree on everything, but we could get to some point where we'd say that makes sense. And this last year, in a bipartisan way, we funded completely eliminating everybody on the waiting list, taking care of everybody on the waiting list, and the governor vetoed it. And there was talk about coming back and trying to do a supplemental where we'd pass something in January and try and get it back. But the governor said today, actually, January 8th, at a press event in Des Moines, that he's not going to entertain any supplementals. So there's probably not much hope there. So sometimes the courts make really good decisions where politicians just can't get it together. So I can think of another big decision in Iowa where the courts made a really wise decision that the politicians never would have made it, or we'd still be in the dark on, and that'd be in the area of marriage equality. The Iowa legislature never would have approved marriage equality by now had the court made the decision for us. And I think in the area of funding for disability services, we may need to be told by somebody we're just not cutting it.
well, and it seems incredibly frustrating that the governor fought not to have the Affordable Care Act, not to accept federal dollars because he didn't trust the feds to fulfill their obligation. And from where I sit, that's exactly what he's doing right now with the counties. Oh, we're going to move from county to state, and it'll be funded that way, and yada, yada, yada. And oh, by the way, we're not going to give you the money you need, and anything you may get to go ahead for other things you need, we're going to take back. You know, it just,
Well,
I don't understand.
You know, when we started to talk about redesign, we saw that we in 2009, even before that, it's gone on for a while. We saw the Affordable Care Act out on the horizon as this opportunity to provide mental health services to a whole bunch of Iowans that are poor, that are currently in the county system, that if they had somebody else help and pay for their services, we'd bring a little headroom within the county budgets that are currently strapped. And those resources could be redeployed to develop this emergency stuff in crisis service, maintain the developmental disability services, maintain services in our residential care facilities, begin to try and figure out how to slowly provide services to people with brain injuries, which is an expensive proposition. But the moment before, as part of approving this thing in Iowa, they put this language on that we couldn't get off the bill brought by the Republicans that we negotiated with, the governor principally, and here we are. And part of the conversation when we go back to work next week in Des Moines is, can we delay this clawback? Can we put this off? How can you even begin to calculate any kind of savings in the system? Affordable Care Act's just begun a week ago, and people are looking at the balance sheet trying to figure out a way to claw money out of the mental health system. It doesn't make any sense.
I think it is extremely important that that waiting list clearing funding happens this year, because what I am seeing, and one of the chief issues that I had with, which I voted for the final Medicaid expansion, the merging of that with the Healthy Iowa plan, but I voted against the original straight up Medicaid expansion. And my concern is that you see the commitments we made last year in the areas of education reform, property tax relief. We've committed ourselves to a lot of money down the road in future budgets. And part of the reason, and I'm not here to be the governor's lawyer, I'm my own person, and we agree sometimes and disagree sometimes. But part of his concern about the federal government not coming up with their money they promise is a concern that I share. If you look at from 2006 to 2012, the share of the state's Medicaid dollars that we were responsible for in our partnership with the federal government, our share increased $160 million. That's more than we appropriate for the entire judicial system budget. And so with this Affordable Care Act and all these new folks on Medicaid, I'm glad they have health coverage now. But that means that in the future, the state of Iowa is going to be on the hook for a lot more dollars. And I still don't believe that the federal government, $16 trillion in debt, is going to be able to fulfill their financial obligations to us that they promised. That being said, we can't yank away health care from folks that already have it right now. And so I guess I'm just saying that that's going to be a larger part of the budget. And it's why we are in relatively strong fiscal health this year. It is an important year to get that money back that was vetoed, in my opinion.
Absolutely. Well, in all of the talk about this, I recently went through the report from the Federal Long-Term Care Commission, who were assigned a task to basically come up with a new system. There were 15 people on the task force. There was a report by 9 of them, the majority, and 6 of them who didn't agree with the report and who released their own. And there's an incredible amount of information in it and all kinds of interesting ideas, as well as ideas that have been thrown around for years. Things like eliminating the 3-day in-hospital requirement before somebody with Medicare can move to a skilled nursing facility and have that paid for. Because there's too many cases now where hospitals are holding people in the observation category for several days and they never actually get categorized as inpatient for the time. Looking at the changes to the Medicare system and things like the Homebound Requirement, which essentially says to get services paid for, it takes extraordinary effort for somebody to leave their home. And they define that as needing some kind of an assistive device, whether it be a walker or a power wheelchair, specialized transportation, that kind of thing. Other than for church and to get your hair done. Who was involved in that one, Sally?
I'm missing it.
But, and also for the type of equipment people get. Equipment, for the most part, purchased by Medicare is intended for people to use in their home. Well, that doesn't always work. There's a rule that says something about if you can ambulate X number of steps, then you don't need a walker or wheelchair or that kind of stuff. Those things simply push people into an institution or turn their home or apartment into an institution because they can never leave. Changes in Medicaid issues. The one that has bothered me for part of 5 decades now, in 1971, when I had my accident and broke my neck, the resource limit you could have and qualify for Medicaid was $2,000. Anybody want to guess what it is today? $2,000. So I got curious enough as I was preparing a report on this stuff to look and see in 2013 how much money it would take to buy $2,000 worth of whatever in 1971 dollars. And it would take $11,509.38 to have that amount equal. My wheelchair cost $26,000. Overhead lifts are a ton. Shower chairs aren't covered because bed baths are good enough. Modifications to bathrooms aren't covered. None of the adaptive equipment on a van is covered. This doesn't make any sense. It just plain and simply isn't cheap being us. And to say if you've got $2,000, then if some piece of equipment breaks and isn't covered because, Medicare, Medicaid may buy this wheelchair, but there's like 5 years before you're eligible for another one, and there's a time on basically each piece of it where they don't pay if something's broke. My right motor's going out. Well, because I think I'm 1 year away from having had this long enough, I'll get the new motor, but that will push my timeline out either 2 or 3 years for a new chair. Not that I need a new chair. I truly don't believe in the theory, I'm entitled to it, I'm going to get it regardless. A couple of years ago, I had a rail break on my hospital bed. Called the people to come out and look at it. Well, we see here you got this in 2004, 2005. You're eligible for a new bed. I don't need a new bed. I simply need the old-fashioned rail on it because the new hospital beds and those god-awful plastic rails with bars that go horizontal, vertical instead of horizontal, do me no good. These are all things that would make life better, would allow people to stay in their homes if we can get the health provider system worked out. But there's all kinds of stuff that,
Oh, yeah.
that they recommended, and I don't know whether it's all ever going to happen because, you know, one of the most interesting thing they talked about were all the different agencies that provide some type of long-term supports and services for somebody, whether it's kids, whether it's folks with disabilities, whether it's the aging population. And everybody's got their own criteria. Everybody's got their own requirements. And wouldn't it make more sense to come up with one universal assessment tool to use for all of them and put all the money in one pot and probably provide a whole lot more services? Now, I don't know, short of throwing all the directors in a room and seeing who comes out, how you're going to get that to happen. But you know, there are things that just make so much sense that would be, if not less expensive, would serve more people.
I don't know where we ever got away from common sense in the systems, you know, and that's just the point we are. I remember years ago when I first started social work, and it's been a good many years ago, my supervisor handed me a case and said, Sally, see what you can do for this family. And now, you know, it's just full of so many rules and regulations that you have to, you know, constantly putting a round peg in a square hole, you know, that it's just unfortunate that we've gotten to a system like that today, and that's what you're outlined.
Two comments. First of all, I didn't realize the inequity of the $2,000 versus in today's dollars that being $11,500. That's the same argument that we're using with the fuel tax, so that you can't pay 2013's bills based off of 1989's funds. Mm-hmm. And that's what they're asking you to do. And I guess I'm with Sally that I don't understand why we got away from common sense. I like to reward responsibility. I don't understand why someone like you couldn't receive a credit. If you're not using up your annual upgrades, you should be able to take that and put it towards something else. You know, rewarding those that are that think like you do.
Well, and I have told people, the 2000 thing has driven me crazy, as I say, for years, because I see that as my being penalized. If I can be frugal, and my family says I have to go on a spending spree just to get up to the frugal level, and live within the requirements of programs I'm on and not spend all that money, why can't I save it above $2,000? Sure. Makes no sense, you know. It just seems dumb. I've got to go out and spend it. Mm-hmm. But you know, there's the logic or illogic hidden somewhere in there.
So that's a part of a federal requirement. That's something, you know.
The feds do everything right. I don't know what you're.
Well, I'm sure at one point somebody thought that up, and people said, "Look, Dad, that makes sense. Let's do that." A very long time ago.
I bet it did in 1971. It's 2013.
Yeah. It's hard to change some things like that. It takes an organized effort and educating members of Congress. Mm-hmm.
And I think that's something that we've got to start.
Well, if you look at Iowa, we're one of only 3 states with split government. We know how to get along. We have our disagreements, and not every year is holding hands and singing Kumbaya like last year. But I know I take pride in having strong relationships with the other side. I take pride in voting with the other side a lot, and every bill I run has a Democratic amendment on it. Just because I feel like that it's a 2-party system and that you should work together. And so I just wish that the feds would come together and use that sort of common sense. And both sides are just as bad at it as the other. And if they could be more like us, problems like these that are so simple and get lost in the federal abyss should be able to be rectified. It shouldn't be that big of a deal.
Exactly. And it makes me so happy when I tell people that, you know, well, I'm having my annual pre-legislation showing. Who's going to be there? Well, I have commitments from all my legislators. What? You've got what? No, that can't be. How do you do that? I ask. Mm-hmm. And, you know, don't have to have a referee because everybody treats everybody else civilly. And, you know, I'm so happy and proud that it's like that and that people can be so awed and say, you can do the same thing with yours. You know, it's just ridiculous how many folks out there think that you guys are just non-approachable.
Sure.
Call, you know.
Yeah.
I've called several and they come over to my condo and we have a conversation. They do what? It's usually easier for me if they come over. So I've had several of them come over. Oh, that just doesn't make any sense. Makes all the sense in the world. But, well, we've just ripped through another 20 however minutes. Again, thank you all
Thank you.
Happy
for
to be here.
being here.
And you will invite us back again, won't you,
Of
Terry?
course, we got to have to do the after session show.
Right.
And certainly, let me know what things I or other folks with disabilities can help you out on.
Appreciate
We're
that.
eager to
Good.
go after it. I'm sure I'll see you again soon.
Thank you.
Thanks.
Thanks.
Thanks, everybody out there. See you next week.